Hello there. Welcome to this presentation on acupuncture. So my name is Mike Cummings. I'm Medical Director of the British Medical Acupuncture Society, and I have an honorary appointment at the Royal London Hospital for Integrated Medicine, where I support acupuncture services within the NHS. What I'm going to do in the next 15 minutes is give you some definitions of acupuncture, one main definition, but also another one. I'm going to talk briefly about the origins, where it comes from, where we think it comes from, how it works, and where it works best from our point of view, including some uses alongside conventional medicine, particularly in counteracting some of the side effects of conventional medicine, the necessary side effects. And then I'll give you a couple of quick case studies at the end. Then we'll have some questions. So what is the definition of acupuncture? Well, the key definition is the one I've got at the top here. This is my favorite, and it was agreed by a variety of groups that got together when some years ago we were talking about regulation of acupuncture in the UK. So the insertion of fine, solid, filiform needles into the body for therapeutic purposes, prevention of illness or maintenance of health. Now, if you're not familiar with acupuncture needles, they are very fine in comparison to the needles you may well have come across, the ones we use in medicine, the hypodermic needles for either taking blood or giving injections. Acupuncture needles are much finer. Very often they would fit down the middle of one of those, even the smallest hypodermic needles. They come in different sizes, of course, and different lengths. But the important thing about them is they're shaped. They're pointy, a nice smooth point, and the importance of that is there's no cutting edge to them as there is in a hypodermic needle. So in fact, tissues tend to separate around the needle as it's inserted, and then when you take it out, the elasticity of the tissues tends to just seal up again all the hole. So it's actually very uncommon to see even any bleeding with acupuncture because of that. Now that's my favorite definition of acupuncture, to do with needles and to do with treatment. And many of you will be familiar with that. I need to introduce this, and it's a little bit problematic, and that is that some people and some groups will define acupuncture based on acupuncture points, which are theoretical entities, and you may be familiar with them from looking at meridian charts from China with the dots on where the acupuncture points are. Whilst they clearly exist as a phenomenon that have been described, it's not so easy to find them in real life, in real people, when you're, whether it be with imaging or physical examination. It's not as easy, or histological examination, or any way you look at the body, it's not clear that they have a discrete existence in their own right, that there's something special about the acupuncture point. And indeed, in the early days, they probably were more like areas, and you had to find, as the clinician, you had to find the right spot for that patient. Anyway, cut a long story short, some people use acupuncture as a label to define anything therapeutic that you try to do at acupuncture points, and that might be pressure, acupressure. We've got a separate word for that, so that's okay. Moxibustion is burning of a herb, Artemisia vulgaris, that you then heat in the location of an acupuncture point or elsewhere. And then you can use electrical stimulation. So with TENS, like transcutaneous electrical acupoint stimulation is like TENS applied to acupuncture points. And then, of course, there's laser acupuncture, which is even more problematic because it isn't the same stimulus as any of the others. It's a specific type of stimulus, and again, it may well be therapeutic, but it's not really the sort of acupuncture where we mainly talk about with needles. And needles are very much like needles are quite like acupressure in a way, but much more intense in a very small area. So there are some similarities between acupressure and acupuncture. Acupuncture tends to be a little bit more potent. Okay, so where did it all come from? Most people think of it as coming from China, and indeed, as I've listed here, the second one down, the most comprehensive system of the use of acupuncture in healthcare comes from China, about 2,000 years ago. Interestingly, though, if you go much beyond 2,000 years, there's no sign of acupuncture in China. And it appeared over a relatively short time period, maybe 200 years, into an existing, quite advanced system of medicine that is traditional Chinese medicine. And it was sort of slotted in over maybe 200 years, and so that there was a complete system within healthcare. And of course, that Chinese medicine includes both acupuncture and herbal medicine is very important and prominent, and other aspects, manual therapy, Tuinar, moxibustion, and various other things. Now, treatments, if you broaden it out and just look at treatments that are like acupuncture, so stimulation with sharp objects, say, or piercing the skin, those type of things, then those type of treatments developed widely around the world in different communities. And one of the oldest actually comes from Europe, if you're familiar with the Iceman from the Tyrolean Alps, who's got a bunch of tattoos all over him that seem to be very similar to acupuncture point areas, and they seem to be therapeutic. I won't go into any more detail of that, but it's quite a convincing story, but it's just one story. He happened to be put into deep freeze by natural circumstances, a glacier forming 5,200 years ago. I mean, he's really old and very well preserved. So he's been very well studied. Very interesting, his backstory. But anyway, so he may have had a type of acupuncture from millennia ago in Europe, but similar treatments have popped up in basically everywhere there are humans. They have used similar sort of techniques. Now, whether or not they were completely independent is always difficult to say. With, so the messages can spread, and we don't necessarily see that historical in the historical record. So it's always difficult to tell how much has been copied and how much has been spread. Now, the scientific study of acupuncture has been going on for about 60 years. It started in China, then very rapidly afterwards, there were groups in Canada and Sweden who studied it. And then more and more was found out. And it really gained in credibility back 50, 60 years ago because of the discovery of endorphins, and acupuncture was integral to that discovery. The fact that we had these natural painkillers inside us that you could release with techniques like acupuncture. Now, how does it work? That brings us on to how it works. And I've mentioned endorphins already. Of course, the ancient explanation is in terms of the ancient language of Chinese medicine, which is about meridians and it's about the flow of qi. Now, both of those things are quite hard to define, and I won't try and do it now. But in very brief terms, if you say got a pain in your shoulder, then from a Chinese perspective, they'd say, oh, you've probably got a blockage of qi in this particular meridian, in this case, the gallbladder meridian. And if you put a needle in, or you do a manual technique as well, you could try and release it manually, or you could use a needle, which is very good at unblocking the qi. And as soon as you put a needle in, typically you'll then feel this sensation up to your head. It goes along the line of the meridian, and that may well have been, those type of phenomena may well have been integral in the development of, the idea of meridians in the first place, this referred pain or referred sensation. And then hopefully you get better. And that puts you back into normal flow, and everything's going well. So that's the more traditional explanation. Nowadays, we know that acupuncture works through stimulation of nerves, principally stimulation of nerves, and then various effects within the nervous system. Now, pain is one of the key things that we see treated, and that's a lot of the early research was on how it works in pain. We know that quite well, but it turns out that there are actually lots of other effects, of subtle balancing effects in different parts of the nervous system, such that you can affect visceral function and a variety of other things. Most recently, the most fascinating one is this anti-inflammatory effect that can occur over the whole system, which can, whilst it is quite subtle, under certain circumstances, could be a dramatic intervention. Now, so where do we use it? I put muscle pain at the top because that's my favorite. I came across acupuncture by accident in the military when I was a doctor in the military, and I was treating lots of boys with muscle pain. young men, and I used to inject things, but acupuncture was so much simpler and it worked so well. I would basically use one needle and one treatment. It was fabulous. Subsequently, as I got more into acupuncture and looked at more research, it's become more famous for treating. It's one of the best treatments for treating headaches. More recently, it's been recommended by NICE, as well as for headaches, for chronic pain. Chronic pain is, of course, more difficult to treat, so it's not so dramatic, but certainly has a very useful role there. And typically, treatment of osteoarthrosis, although it's not recommended by NICE for this, I think that's that's mistaken, because the evidence is good and it is very effective and safe way of managing pain and stiffness from osteoarthrosis. It can also influence visceral function. One of the most famous areas is probably overactive bladder, lots of research on that. And then more vague symptoms, hot flushes, fatigue, malaise, perhaps as part of menopause in women, or perhaps as part of other treatments, say cancer treatments. It can have effects on here, but these are much more difficult to measure and to establish clearly that there are effects. But we do use it for this. It does appear to be effective. And then there's this general well-being effect. You particularly see it in people who are very sensitive to acupuncture, and they get off the couch and they feel like they're on cloud nine sometimes, and they'll give you various explanations for it. They just feel so chilled out, and it's great. And that effect lasts a variable amount of time. It may be related to the immediate release of certain neurochemicals such as endorphins. Who knows? But it's quite interesting. You tend to only hear it described in the very sensitive people, but there probably is a milder effect in many others as well. And so we do tend to see that. Now, what about uses alongside conventional medicine? I've already mentioned cancer care. This is a big area because, there aren't a lot of treatments for the sort of side effects that we see here from surgery, chemotherapy, radiotherapy, hormone therapy. Hormone therapy is perhaps the most famous, with hot flushes, joint pains related to aromatase inhibitors, which are used in breast cancer nowadays. And acupuncture is a very good treatment for the joint pain associated with this. Also for hot flushes related to these drugs, both in men and women. So men with prostate cancer also suffer the same thing with androgen suppressive therapy. Chemotherapy, in some nasty types of chemotherapy, can really badly affect peripheral nerves, and you get a chemotherapy-induced peripheral neuropathy. Acupuncture looks like it can help prevent that happening. It can protect the nerves to some degree, or treat it if it's occurred. It's not so good if it occurred years ago. It's not so easy, but if you get in there during the treatment, it seems to be very useful. Other areas other than cancer care, I've got a colleague of mine is an anaesthetist. He's done lots of research in these areas, pre-op anxiety, post-operative pain, so working together with conventional care. And it's most famous for, of course, post-operative nausea and vomiting, so-called POMV, as I've put down here. There's lots and lots of research on that. Very useful treatment, actually not really utilized as much as it should be, given the evidence in that area. And I could go on to lots of other examples. How about just a couple of cases just from I've been using acupuncture now since the 90s, early 90s, and I've written up several dramatic cases that have occurred. And this is one of them I wrote up some years ago. And I'm very much interested in muscle pain. This was a young woman who had, she had a dysplastic hip. So she had very early osteoarthrosis in that hip and had multiple operative procedures trying to preserve the function of the hip, till finally, I think it was her 5th procedure, was a surface replacement. And it was wonderful. She had no pain afterwards. But not long after that, I think it was within the same year of surgery, she went off on holiday in the winter to a hot climate, and she was there for a week or two, and she came back to a damp and cold London, and her pain came back. Her pain came back, and her pain that came from the hip joint, she felt in her knee. That's not uncommon to have hip pain referred to the knee. Anyway, and she was shocked, so she immediately got in touch with the surgeon and said, "Oh, there's something wrong." And the surgeon saw her and did some x-rays, and he said, "Oh, everything's fine. Everything's completely fine." And she said, "But I've got my pain, my hip pain has come back. It's, the pain in my knee that is referred from my hip. And eventually she came to see me, and I thought, oh, this is very interesting. And I was looking around, and of course I was looking for a muscle source because that was my area of interest. And I needled her all over. The needle's very useful in assessing patients because it can put high pressure on muscle, and you can ask the patient, is this creating your pain? And I did that with her, and I went back and all sorts of areas. Eventually I ended up in a muscle over the top of the hip joint called the psoas muscle. One needle reproduced her pain. And she went, okay, that's it. That's my pain. That's in my knee. And because of the position of it, and it's, I didn't want to do a lot of movement of the needle, so I used electrical stimulation. A few sessions and the pain was gone. And I did actually follow her up several years later, and she was still fine. So it hadn't happened again. I think she was avoiding this sort of sudden change from hot climates to cold and damp. Which does affect muscle, of course. That's another story. So, very interesting treatment, a very brief treatment course. Now, and the last one, a bit of a longer treatment course. A patient who came to me after having chronic headache for 15 years, daily headache, 15 years. She was a type of migraine. She had taken lots of different treatments. She was actively being treated with topiramate, a drug at the time. And she kept on coming, and she didn't like being needled. And I wanted to stop. And I had done 6 sessions, nothing had happened. She still had a headache. And I said, look, normally we see something by now. I think we should stop. And she said, no, I must carry on. I've got nothing else to do. She forced me to continue. And I'm very pleased she did, because by 9 sessions, something was starting to happen. By 12 sessions, she was headache free for the first time in 15 years. I was really shocked, and I thought, oh, I've been under-treating these patients. I was expecting to see a little dip, in their headaches after treatment, but I misunderstood really we don't really understand headaches that well. So anyway, it was great. And she's still headache-free. She comes every so often, but her life has changed. And many acupuncturists will tell you stories like that they have patients like that. But they're just a couple of examples. So in summary, acupuncture is a safe treatment. So side effects are incredibly rare, but you should go to somebody who's trained, and you can find practitioners you should find a practitioner who's regulated. And you can look on the IMA website for the information sheet, and you can see links to some of the big groups of regulated practitioners and describing more details there. Often works very well alongside conventional medicine, and it is formally recognized by NICE in these guidelines here for headaches and chronic pain. And there's lots of research, and increasingly research supporting the use of acupuncture in wider areas. So thank you for listening to me. Here are all of, these are all of the groups that are part of the IMA. This is me here as part of the British Medical Acupuncture Society. There are other acupuncture groups as well, which I give you some information in the information sheets on the IMA website. So any questions? I've got a couple of minutes left before we've got a couple of minutes left. What's the most common question people ask me? Does it hurt? But it's impossible to tell. It depends on how sensitive you are. Mostly it doesn't hurt. Many patients don't feel anything. We try and get them to feel a little bit, but on the whole, on the majority, don't feel much. So mostly it's okay. We're gentle to start with. We can use fine needles. We can use it in children. So, the biggest problem is in an individual's anxiety. And usually we can get over that. Is it available on the NHS? Well, it is in some areas. It is in our hospital in central London, but it's not universally available easily. We're trying to address that. We're trying to, promote its use. And it used to be more widely available in the NHS. Say 20 years ago, it was in most pain clinics. That has changed over time. We're trying to encourage more use. We're actually trying to encourage more use of acupuncture in the third sector alongside the NHS to support use. Because, of course, if it's good for treating chronic musculoskeletal pain, then there's going to be a massive unmet need. And it is good at that. So, it's going to be a challenge to provide that on the NHS. How do I find a regulated practitioner? You go to the IMA website and you have a look at the information sheet on acupuncture, and it's got links to the 3 main bodies where you can find those. So thank you for listening. Great. Thanks very much.